Regulations relating to professional conduct of registered medical practitioners, also commonly known as Professional Conduct of RMPS or National Medical Commission Registered Medical Practitioner, Professional Conduct, Regulations, 2023. Disclaimer. The mentioned details are interpretations based on publicly available information. For specific details or completeness and accuracy, audience is advised to refer original document on official government website. What are duties of RMPS towards their patients? Keeping appointments. RMP shall endeavor to be prompt in attending to the patients and should keep in time with appointments or visiting, consultation hours. If the RMP is delayed for a valid reason, the patient should be informed. RMP may also advise referral when necessary to another RMP who is specialized in the treatment of the patient's ailment. In case of emergency, life and limb-saving procedure, RMP shall provide first aid and other services to the patient according to his expertise and the available resources before referral. Incapacity. A registered medical practitioner having any incapacity, induced or otherwise, detrimental to the patient or professional practice, which can affect his decision-making or skill in treating the patient is not permitted to practice his profession for the period of incapacity. Use of alcohol or other intoxicants or being under influence during duty which can affect professional practice will constitute misconduct. Confidentiality. Every communication between RMP and patients shall be kept confidential. Such communication, whether personal or related to health and treatment, shall not be revealed unless required by the laws of the state, or if non-disclosure may itself be detrimental to the health of the patient or another human being. Truth-telling. RMP should neither exaggerate nor minimize the gravity of a patient's condition. She shall ensure that the patient or legally appointed representative has such knowledge of the patient's condition that can assist in making decisions that will best serve the interests of the patient. Patient care. RMP is free to choose whom he will serve, except in case of a life-threatening emergency. Having accepted a case, the RMP should neither neglect the patient nor withdraw from the case without giving adequate notice to the patient and his family. If a change of RMP is needed, for example, the patient needs a procedure done by another RMP, consent should be obtained from the patient himself or the guardian. The RMP who attends to the patient will be fully accountable for his actions and entitled to the appropriate fees. In case of abusive, unruly, and violent patients or relatives, the RMP can document and report the behavior and refuse to treat the patient. Such patients should be referred for further treatment elsewhere. Referral. Only such follow-up consultation should be planned as required by the patient. Likewise, laboratory investigations ordered for the patient should be justified. An update, summary of the clinical condition and reasons for referral must be documented and provided at the referral. Specialist referral must be sought to benefit only the patient and duly justified in medical documents. Signatures. All signatures in the notes, prescriptions, certificates, orders, referral summaries etc. should carry the RMPS name and NMC registration number. Electronic generation of orders, prescriptions may help. Automation of this information. Telemedicine guideline. Consultation by telemedicine. Consultation through telemedicine by the registered medical practitioner shall be permissible following the telemedicine practice guidelines.